how physicians can reopen their practices safely on this week's Medical Economics Pulse.
So your office is going to kind of do this accordion thing. I think people are going to open, 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 close, 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 sort of open. So I think also communicating that this is dynamic, probably until at least the end of the year. So the processes you develop on Monday may not be in place 2 months from now. And so again, just the patience of what that looks like.
This is a challenging time for many practices. As a result of COVID-19, physicians are grappling with financial struggles, staffing concerns, and patient needs. And now, practices across the country are in the process of reopening to in-person visits. So, what must practices do to reopen safely and efficiently? How can they balance between alleviating patient concerns while restarting traditional services that are crucial to practice survival? Today, I sat down with Dr. Geeta Nayyar, Chief Medical Officer for Greenway, to discuss how physicians can make their reopening a safe success. Dr. Nayyar, thanks very much for joining us today.
My pleasure. Thanks for having me on.
So the first question is, what should physicians consider before reopening their practice? Specifically, what criteria should they use to make the decision?
Sure. Well, the first thing is knowing what's going on in their particular region and locality, right? So there's definitely regional advice. So I would first and foremost be looking at that and be following CDC as well as local guidelines. But secondly, it's really about how to get your patients and staff back to the office safely, how to maintain that safety. And again, as you can imagine, the volume of sort of the backlog. So it's how do you recover in a way that is also the most valuable for your patients, so the patients that are the most sick, the patients that have an acute issue, and then also just keeping in mind, how do you take care of the patients that don't want to come in? So again, a lot of folks have overnight developed an affection for telemedicine, right? So how are you doing telemedicine plus the old brick and mortar practice, and how do you manage that are really the things folks need to consider right now.
So let's talk a little bit about safety protocols. Can you talk about what new safety protocols are needed for practices?
Sure. Well, the first thing is, again, the same guidelines that we have in society. So keeping people 6 feet apart, wearing masks, making sure surfaces and there's no contact, and making sure that, you know, once a patient has been seen, that the room is able to be completely disinfected and wiped down. And when we think about PPE, it's now not just PPE for the staff, but it's also PPE for your patients, right? So are they coming in with gloves, a mask? Are you providing them? Is it just mandatory that they do this themselves? So a lot of this, again, we've never had to do before. So this is really a new world, and you'll see a lot of folks also making patients wait in a virtual waiting room, which is frankly their car most of the time, right? Or one person in the waiting room, to keep that gap and ensure that distance. Definitely, if anyone in the office turns out to be COVID positive, anyone in the staff, a patient, there's just a whole protocol you have to follow in terms of making sure anyone that was around that individual self-quarantines if they're not able to get a test. And if the test results, there's traditionally been a lag. A lot of people are not getting the results right away. So a lot of moving parts.
In terms of staff, you had mentioned making sure that folks aren't bringing the illness into the practice. What are some of the best practices in terms of managing your staff? Should they be taking their temperature every day? What are just some basic guidelines to follow in terms of making sure your staff is staying healthy as well?
Right. So, it's safety first. It's safety first. So again, just treating everyone as you would like to be treated. Or I always say it's the mom test. What would you want to do for your mom, right? Or your child. So it's number one, it's a bit of the honor system. If you're not feeling well, you need to stay home, right? Certainly if you have a temperature, you need to stay home. The problem with taking temperatures, as you know, is most of the cases are asymptomatic, and most of the time that you're actually shedding and the most infectious is right around the time when you do not have a fever, and right around the time when you're just about to start getting sort of symptomatic and have that fever. So this concept of taking temperatures is really, I think, to make some of us feel better. But the truth is, 40% of transmissions are happening in asymptomatic people. So I'm not really sure there's much to do there. So it's really about prevention. This virus is all about not getting it and following all the protocols that we've established to prevent it from spreading.
let's talk a little bit about PPE. Obviously, it's been a huge story in the last few months about a lack of PPE or PPE not being distributed to where it's needed. What did practices need to do to ensure that they have enough and that they can stay open because they have enough PPE for their staff to be able to treat patients?
So I think, inventory, right? So it's a lot of inventory management. It's being in touch with, again, your local regional medical association, your state association. They're doing a lot to help physicians, broadly the public health department. And look, if you run out, you run out, right? This becomes the rate limiting factor of how to do this. But you see people, again, getting very creative about how long they're letting a mask go. Traditionally, we 24 hours and you had to dispose of your mask. Now the hospitals are saying 1 week. So, I think you've just got to use good, sound judgment at this point. And again, I think to the extent we're all helping each other and folks are moving supplies around as they go, and you see the different manufacturing efforts that are out there, my hope is that we're better prepared this time around. But at this moment, we just can never have enough supplies for really where we're going.
Obviously, a lot of physicians' practices have taken a huge financial hit during this. Everybody's been affected economically from the lockdown and the pandemic in general. So many physicians are eager to reopen their practices. How should they effectively balance between the eagerness to reopen and also making sure that you're opening at a safe time in your area? What are some of the things that you really should sort of be your checklist to make sure you're reopening properly?
So again, safety first, right? Knowing what is going on in your particular region and locality. Are you allowed to open, right? Or is the hospitals in your area reopening? For the majority of the country, this is the case. And again, some at a certain capacity and others saying, hey, we're at 100%, just go, go, go. So I think knowing what's going on locally, regionally, an inventory of your staff, who wants to come back, who's comfortable coming back, who's not. What does your inventory look like when it comes to PPE? What's your process and procedure to disinfect rooms? What is your new process of communicating to patients? Because again, if they're waiting in the car, if they're going to wait in the waiting room, there's a whole kind of wraparound communication that patient engagement couldn't be more front and center. Right now, it's going to be really about that engagement and how do you get patients in and out? The key is in and out, and patients also for the first time they want to come in and out. So being very efficient in what has to be done in person and what are the things that don't have to be done in person or can be done virtually. And, what are the things you can do ahead of time? Your copay, getting all those forms done, any screeners, any paperwork, all of that does not need to be done in person, right? If you're doing it smart, if you're doing it well, again, adoption of new technologies now is actually the time because a lot of this existed, but we didn't really have that customer readiness or that patient readiness. And now it's the flip side. It's, doc, do you have an app for that? Doc, how can I Dropbox that to you? Could I text that to you? So you have a consumer now that's saying, doc, I'll do whatever you've got. I'm happy to do it. All of a sudden people are saying, okay, what's that patient portal again? How do I log in? So everything has really flipped on a dime. And I would say the same thing with the discharge process. As soon as the actual clinical visit is done, what is the discharge process that can be done outside of the four walls of the office, right? Is there prescriptions that need to be picked up, patient education, follow-up visits, scheduling your next appointment? That doesn't need to be done in the confines of the office. So moving what needs to be done truly in the office, a clinical procedure, a physical exam, whatever has to be done, okay, but the rest of the sort of back-end office process, I would definitely encourage folks to say, what can we do with our operations to flip it on its head?
Let's talk a little bit more about telehealth and telemedicine in general. How do you think it has performed during this pandemic? And what are some tips that you have for physicians to manage, as you mentioned before, to reintegrate in-person visits with telehealth? Right now, they're doing lots of telehealth, not so many in person. But as they sort of bring those kind of workflows together, what can they do to implement those effectively?
Sure. So, I think it's an exciting time for a doc and tech such as myself, right? We're finally realizing the future is here. It's been here all along. Just the reimbursement and the regulations didn't really allow us to open the tap. So I think it's extraordinary what's happened with telemedicine. It speaks volumes to the workforce shortage that we have now, and we will have even more going forward, given all the things that we've seen with this pandemic. So I think the opportunity here is to really meet the patient where they're at. And it's about the right care at the right time, right? That's what keeps people from going to the emergency room, their own doctor's office, the urgent care, et cetera. So the opportunity is tremendous. We've seen amazing adoption. I think it's very exciting. We're also seeing there are limitations, right? What that physical exam, especially, when you think about specialties like OBGYN, for example, or even in OBGYN where you just have a patient that's like, I just want you to put your hands on my belly because I just feel better when you do that, right? As opposed to a virtual encounter where you say, okay, you look good. Tell me your blood pressure. Tell me your heart rate. So we're learning its limitations. We're having to figure out what is the value of the visit that can be done virtually versus not. And I would just encourage people to say it is a new paradigm, and to the extent physicians are anxious, patients are anxious, you want to keep that good, I call it good webside manner, right? Instead of bedside manner. A lot of my docs, you'll see the camera beautifully placed to their nostril hair, and it's sort of like, no, let's come on, let's rethink this, like, the lighting. So there are things we've never had to think about, but they have a lot to do with the interaction and making the patient comfortable. I think what we've also found is that people have more eye contact when they're on a screen. So many of the patients are used to the doctor not looking at them and typing this way and charting in the EHR, and now everyone's sort of forced to say, hey, how are you? How is it going? And talk to me about your pain levels. And that's really nice, right? I think that's really nice. So there are definitely some positives that have come out of this, but certainly there are limitations, and we'll have to navigate those as we go forward.
What are the best ways to sort of integrate these different types of visits? You're right now doing a schedule full of telehealth visits. Now you're going to be doing some in-person, some telehealth. What's, from a scheduling standpoint and an efficiency standpoint, what are some tips you have for integrating those together effectively?
So I think you've got to, again, first take stock of your own practice, your own specialty, and your own patient population, right? How successful have you been with this or not? And how successfully is your staff adopting this or not? So every office is going to be different. Some folks are saying, okay, Tuesdays and telemedicine Tuesday and Thursdays. It's just going to be, that's when we do our telemedicine visits. You have others that say, Dr. B is going to be our telemedicine doc, and Dr. A is going to do all the in-person visits. Or you have, again, the ancillary staff, right? So you've got a PA, an LPN, that they are going to do the virtual visits and then punt to the doc for what needs to be done in person. So everyone's kind of approaching this differently. You have other folks that are saying, we're going to go back to brick and mortar, and nights and weekends is when we're going to do telemedicine. It's kind of an add-on service. So, I don't think there's one right approach. I think it depends on your practice, your population, and what your workflows and efficiencies tell you. Because I think also people are going to now realize what is truly more efficient versus not. Is that 5-minute telemedicine visit, did I get everything done that I needed to? Or did it actually slow me down from charting, or then the in-person visit where I had X, Y, and Z back-end work to do that I didn't have to do before? So I think we're all continuing to make this up as we go, and that's the opportunity here.
Let's talk about patients with chronic conditions. Obviously, there's a lot that could be done with telehealth to sort of help manage these patients. And these are patients that might have the most concerns about coming in an in-person visit, still wanting to social distance, seclude themselves at home because they're worried about, complications from COVID. Can you talk a little bit about how to help manage patients with chronic conditions, how to help them keep their treatment adherence, and sort of manage between using telehealth and in-person visits?
Sure. So again, I think it's really about, first of all, having a relationship with your doctor, right? If you have a chronic disease, hypertension, diabetes, my world, lupus, rheumatoid arthritis, you should know your doctor should know you, right? It's not the same as going to the CVS Minute Clinic. So if you have a chronic disease, which means that you need to be seen at a regular intervals, you need blood work typically regularly, you're on medications regularly. So that relationship is key, number one. Number two, exactly what can be done in the home, whether it's high tech or low tech, right? A weight scale is a weight scale. Your doctor doesn't care if it's Bluetooth enabled or not. Can you tell me if your weight has gone up or down? That's what I'm looking for. Can you tell me if your heart rate has gone up or down? If wearables help you, if there are devices at home that help you, certainly some really innovative stuff going on in the industry when we look at remote patient monitoring, ways to monitor your finger sticks, ways to monitor your blood pressure. I'm all for it, but at the end of the day, what the physician wants is just the numbers. So if it's about making sure you're more compliant and you're a busy individual, perhaps working from home, and these technologies help you, great. If you're someone who's sort of like, I just don't know, and I also am too afraid to go out and buy some of these things or buy them online. So just grab the weight scale, grab a piece of paper, write it down. So, it's about getting those data points to your doc and having the relationship where your doctor just says, hey, listen, I need to know the trend, because that's what we're looking for. I need to know the trend of what's going up. when, what point of the day or the week, or after you've eaten a certain thing, you've done a certain thing from a physical standpoint. So that's really what we're looking for. And I think that the remote patient monitoring technologies coupled with telemedicine is going to be the new healthcare. And why not in your home, right? You are safer at home. That's the other thing we've realized, is that patients are safer at home. And we want to know what's going on before they have to actually interact with the healthcare system, even if that's just our doctor's office, let alone the emergency room.
Another question about staff. Obviously, it's a difficult time for everybody, and I'm wondering what physicians, as sort of leaders of their care team, need to do to sort of keep morale up, help deal with burnout, all those sort of staff morale issues that may crop up as a result of the pandemic and just sort of the strange situation we're in right now.
You know, I think like every business, everyone's struggling financially. People are anxious about their jobs, their cash flow. So I think the same as every business, and really it's safety first. I would say that in the medical world right now, there's definitely a sense of mission and purpose, even for folks who might have a delay in their paycheck or have a delay in whatever might be going on, or furloughing staff. You couldn't have a more committed workforce at this moment. So I think that relationship has become even stronger, particularly in the small businesses that are typically family businesses or people and staff that have worked with docs for years. So I think that there's actually an appreciation for each other, but definitely all the same economic pressures are there, and taking advantage of anything possible in all the different things that the federal government is trying to do for small businesses is going to be important. And again, I think it's also the medical community coming together and helping each other regionally, sharing best practices, saying, hey, for my specialty, this is what I've done with telemedicine. You're seeing a lot of that from the medical associations out there. And I think continuing that dialogue is really important.
Last question, is there anything that we haven't discussed that you think it's important for physicians to consider as they reopen their practices and return to some semblance of quote unquote normal?
Yeah, you know, I would say one of the things we talk a lot about recovery inpatient, and then there's recovery outpatient. I do think they dovetail, right? Because if you're going to go in for hip surgery, you need that pre-op with your primary care doc. So, you know, the same way the hospitals are doing it, which is that they've formed teams, and they've formed kind of a metric of how they're going to decide who gets surgery first, who gets the procedure first. I think from a liability perspective, a lot of people are looking at that, and from an ethical perspective, right? If I have a patient panel of 5,000 patients and they all want to come in next week, that's not going to happen. So what are the criteria I'm using to bring people back? Are they the 65 plus population? Are they the ones that have a fever and a cough? What are kind of your criteria for who gets seen first? There's a bit of a triage happening now that we've not had to do before in an outpatient setting. I would also say that dovetails with your inpatient setting, so knowing what's going on with your local hospital and what their recovery plan looks like. Communication. Traditionally, the doctor's office, worst place to communicate. You call, you're on hold, you leave a message. The more you're communicating with your patients right now, the more you're investing in things like patient engagement. Again, it doesn't have to be high tech necessarily, but they want to know, are you open? Are you closing? What are your process and procedures? And how do they get a message to you during office hours, after office hours? What's the health of your staff? So I would say basic kind of common sense consumer practices that we've just not had to think about in medicine, right? And so communication is key, safety first by all means, and just how are you triaging? How are you doing it? How are you communicating that as well? Because it might behoove you to also say to your patients, look, if you're young and healthy and just coming in for your annual, we'll get back to you after flu season, or we'll get back to you for just come in for your flu shot, but we're not actually going to have time to see you because we have all these sicker patients. So I think we're all helping each other out. I mean, we really are in this together. And so I think it's a great time to partner with your patients and not underestimate that they're looking for that leadership. I think we're all looking for leadership. And so figuring it out together could probably be the most impactful thing that we do. And the other thing I would say is that we might recover and then close and then recover again. And, you know, there's a lot of dialogue about the second wave. Flu season is going to be that much harder this year. So your office is going to kind of do this accordion thing. I think people are going to open, close, sort of open. So I think also communicating that this is dynamic, probably until at least the end of the year. So the processes you develop on Monday may not be in place 2 months from now. And so again, just the patience of what that looks like is important.
Dr. Geeta Nayyar, thank you very much for joining us today.
Thank you. Thank you so much for having me. Be safe.
You too.